Hello everyone, we hope you're all okay. Today me, Zeynep Erdoğan, and my friend Hüsniye Erdem are going to present you our presentation, which was prepared by our team as me, Zeynep Erdoğan, Hüsniye Erdem, Merve Dilsizoğlu, and Hana Şekeral, named Lemon Cologne. And our supervisor is Ayşe Şule Kılıç. Plus, the presentation is about healthcare innovations and mental health anxiety management during the pandemic. We are from Turkey and we are studying at Sakıp Sabancı Anatolian High School. Our school, which was founded by Sakıp Sabancı, a successful businessman, is located in Beşiktaş, Turkey. In addition, we have the International Baccalaureate Diploma program, which means we are an international school. And also, we have lots of clubs in our school, included the ones in English. HES code. During controlled social life conditions, HES, which means life fits into home code, helps you safely share your COVID-19 risk status with institutions and individuals for activities like transportation or visit. Shared HES codes can be checked through the app or services provided to institutions. This code solely serves as a risk mitigant for infection in long-distance transportation vehicles during travel. COVID-19 patients or contacted people will not be able to use public transportation. We use this code to inform you if anyone in the same vehicle is diagnosed as positive. Reasons of anxiety during the pandemic. Compulsory isolation from society. Feelings of fear, anger, worry, frustration, lack of concentration, lack of sleep, and increase in nightmares. Now, my friend Hüsniye will tell you more. The floor is yours, Hüsniye.
Anxiety management for past and current infections. Since COVID-19 was declared an international public health emergency, youth have been exposed to anxiety and devastating damages in their lives. Pandemic mostly affected youth because of the rapid and urgent restrictions. Moreover, those conditions have disruptive pressure on children. Depression and generalized anxiety are two of the most common mental health concerns in youth. Depressive symptoms, which include feelings of sadness, loss of interest, and pleasure in activities, as well as disruption to regulatory functions such as sleep and appetite, could be elevated during the pandemic as a result of social isolation due to school closures and physical distancing requirements. Adults and young adults. Not surprisingly, quarantine has effects on adults regarding to economical, mental, and health issues. They also have anxiety, depression, worry, and frustration. As the pandemic wears on, ongoing and necessary public health measures expose many people experiencing situations linked to poor mental health outcomes, such as isolation and job loss. Young adults have experienced a number of pandemic-related consequences, such as closures of universities and loss of income, that may contribute to poor mental health. Compared to all adults, young adults are more likely to report substance use and suicidal thoughts. Research from prior economic downturns shows that job loss is associated with increased depression, anxiety, distress, and low self-esteem, and may lead to higher rates of substance use disorder and suicide. Senior citizens. Older people are at higher risk of suffering negative outcomes, which can lead to an elevated rate of mortality, being 5 times higher than the global average for those older than 80 years old. Naturally, this reveals an appalling fear on elderly people linked to higher risks. Elder people are not only physically affected during quarantine, but also mentally. Several studies have described mental health consequences in previous quarantines, such as high risk of depression, emotional disturbance, stress, low mood, irritability, or insomnia being also associated with higher rates of suicide in an elderly population. Because of the inherent result of human growth, senior citizens are not able to socialize as much as they as much as the young people. Prior to the pandemic, they were also isolated, and when the orders were implemented, it became really hard to avoid loneliness for elder people. How to cope with anxiety. During the pandemic, people couldn't find any chance to have face-to-face communication, but it's significant for human body and their mental health because it is a humanitarian need that affected people a lot. So we have to talk with people during the quarantine, at least via our phones or social media. That helps us to keep in touch with others and share our thoughts. Regular exercises. During the pandemic, gyms, sports clubs, pools are all closed, so keeping your form is essential. Every day, people must do some exercise. It will also help them to have a clear mind. In this way, they can keep themselves occupied and worry less. Healthy eating. During the quarantine, food companies have increased. People choose to eat fast foods because buying is easier than ever. Only by clicking a button, your meal is ready. Recently, people don't even want to go to markets that are close to their apartments. Easiness brings laziness. So you need to get some fresh food. Prepare your meal and don't forget to drink lots of water during the day. These days, we cannot go outside and breathe fresh air, so it is our responsibility to take care of our bodies. Comfy sleep. Sleeping between particular and regular hours of sleep helps you to experience a comfortable sleep. So you need to avoid napping in order to be tired and sleep easily. If your mind is filled with worry and fear, you can write them down before you go to bed. This helps you to think less and focus on sleeping. These are resources. Thank you for giving your attention to our presentation. Thank you for listening.